I've just dropped my husband off at a football presentation and he has to bring his aftershave with him and then spray it outside the car when he gets there. Because if he wears it in the car, then my sensory issues get too much and I will have a bad headache straight away and feel sick. So this is what we have to do each time. To be honest, I cannot cope with the smell of chemical anything. In this video, I am going to tell you how to advocate for yourself when it comes to your health. And I am also talking about something that has been going on with me recently. July is Hyperparathyroidism Awareness Month, and I'm going to be talking all about that today because that is what I'm experiencing at the moment. This is such an unknown disease that most GPs don't know much about it. Some do, some don't. And I only ever heard of it in March this year. So I'm going to be talking about it today in case it helps any of you who may be experiencing some of the symptoms that I have as well. So it is so important that we are able to advocate for ourselves as neurodivergent people. It's important for everyone to advocate for themselves because often due to long NHS waiting times, people suffer for a long time. So in March this year, a few months ago, my sister sent me a message telling me that she'd had this blood test and it had shown that she's potentially got hyperparathyroidism and she'll let me know if it's the genetic type. And I was like, I've never heard of it before. What is it? I asked her about the symptoms. She said a lot of the time the symptoms can be similar to diabetes. So I don't know whether you're aware of this, but some diabetes symptoms can be things like frequent urination, increased thirst, persistent urinary tract infections and things like that, along with other symptoms. When she said that, something inside me, my gut instinct was you need to look into this, because over 10 years ago, I remember going to the doctors with increased thirst, frequent urination, and at the time they tested me for diabetes, which came back negative. I started looking into hyperparathyroidism and I realised I actually had a lot of the symptoms, and frequent urination being one of them. Sorry for too much information. Kidney stones in the past. I can't remember exactly how many years ago it was, but I ended up in A&E with severe pain. It was flank pain. And when they did a urine test, they said I had blood in my urine and it seemed like I was passing a kidney stone. So kidney stones are a symptom of hyperparathyroidism. Bone aches, obviously fatigue, which is pretty much a symptom of anything. So fatigue is one of them. There's a lot of symptoms and I'll talk more about those in a minute, but it just got me thinking. That gut instinct really kicked in and I thought I need to do something about this. So get this, hyperparathyroidism is supposed to be rare, but it's never routinely tested for. So how do they know it's rare? Often it is flagged when someone has a blood test and it shows that they have high calcium, then tests may be done into hyperparathyroidism. And I think that's what happened with my sister. So I went to the GP, said my sister's got this, I've got the symptoms, I'd like to be tested for it, because it is being looked into whether it's genetic. She agreed to test me, so she tested me calcium, parathyroid, vitamin D, because they all work together, and she did a kidney function test. So basically there are different types of hyperparathyroidism. There's primary hyperparathyroidism, secondary hyperparathyroidism. The secondary one is usually caused by low vitamin D or decreased kidney. The primary hyperparathyroidism is usually caused by adenomas, which are benign tumours that grow on the parathyroid glands, and the treatment for that is surgery. If it's the secondary type, the treatment, depending on the cause, is often increasing vitamin D or maybe taking calcium and different things depending on the cause. So anyway, when my blood results came back, my calcium came back as normal and my parathyroid was high. I was honestly thinking, it's just going to be low vitamin D. My vitamin D also came back as normal, kind of low end of normal, but still normal enough to not necessarily cause hyperparathyroidism. So the GP rang me, she let me know, and she said, I'm not really sure what to do, so I'm going to speak to endocrinology. Anyway, she rang me a few weeks later and said, endocrinology had said they'll just do a blood test in 6 months and to take high dose vitamin D. And they told her to put me on 800 international units of vitamin D a day as a high dose. And I said to her, I'm already taking 4,000 international units a day, and I have been for a while. So their high dose was definitely not as high as my high dose. So I was already taking that. And when she said about testing me in 6 months, I explained to her that I do have ADHD and autism, and I do have health anxiety. Like, I care a lot about my health, and to wait 6 months just to have a blood test again for something that can cause, I forgot to add this, it can cause osteoporosis and heart problems. And yeah, if left untreated, primary hyperparathyroidism in general can lead to osteoporosis and or heart problems. So obviously it's not something you want to leave, and that made me really nervous. I didn't want to wait 6 months just to have another blood test to see what it was doing. And she agreed that because I was already taking high dose vitamin D, and because of the anxiety I experienced, she agreed to test me again in a month. So she did, and again, my calcium was within the normal range. My parathyroid had almost doubled, so it had gone even higher. They refused to test me vitamin D the second time, which seems a bit ridiculous because the vitamin D is part of the big picture, so you need to see what it's doing. If they'd have tested my vitamin D and it had gone higher, but my parathyroid had gone higher, that would have probably ruled out secondary. So just to add, on both blood tests, my kidney function was normal and healthy. So again, it was looking not very probable that it was secondary hyperparathyroidism because my vitamin D was normal, my kidney function was normal. So she agreed to refer me to endocrinology, and I asked her how long the wait was to be seen by endocrinology, and she said she didn't know. So I looked online to kind of get a rough estimate, and it said in my area it was like a minimum of 8 months wait just to have your first appointment with endocrinology, which again made me feel really nervous because this does turn into osteoporosis or heart problems, and I didn't want to risk that. I had joined this group on Facebook, a hyperparathyroidism group within the UK, and there was so much good information on there. I just want to add as well, this is not the same as hypothyroidism or hyperthyroidism. It's different. Although the thyroid and the parathyroid glands are in the neck, it is a different disease. It's not the same. I also want to add, this is not medical advice. So anyway, I'm in this group on Facebook. It's very helpful. It's got loads of people who have had hyperparathyroidism and had the surgery. It's got people who've got a lot of experience, and there was a lot of really good advice in there. So I put in my dilemma about having to wait a minimum of 8 months just to be seen, and a lot of people also get fobbed off as well because there's not very much known about this disease. So what I ended up doing, I ended up booking a private telephone conversation with a specialist endocrinology surgeon who was actually based in Oxford, so very far away from me. He's got such a good reputation, and also, just to add, sorry, I know I'm talking really fast, because my calcium is normal, there is a type of hyperparathyroidism called normocalcemic hyperparathyroidism. I heard he kind of specialised in that, and also genetic types, which it is possible that both me and my sister have got. So I had this telephone conversation with him. He was lovely. He was so nice, very understanding. I'd already sent over my blood results, and he basically said to me that he could take me on as his patient on the NHS, but he's got a year-long waiting list, and it would mean me having to travel to Oxford for all the tests, which there are quite a lot of tests that need to be done. So he suggested that there was a consultant a lot more local to me, and he suggested that he refer me to her. So he didn't even charge me for the consultation on the phone. This is what he was so lovely and understanding, and I really appreciate how lovely he was and how knowledgeable. So I ended up getting referred to this other consultant who I was booked in with her. Like within 2 days I had an appointment booked with her, and again I was going to pay for a private consultation with her. I had that last week. She's lovely as well. He also said to me, if I was going to get parathyroid surgery, if I needed surgery for it, she would be the one doing it. That's how much he recommended her. I had my consultation with her last week. I took all my blood results and also previous blood tests that I found where my calcium had been tested. And what she told me was, although my calcium is within the normal range, she could see that over the years, my calcium has been going up and my parathyroid has also been going up. And when the calcium goes up, the parathyroid is meant to come down and vice versa. So that pattern suggests that I probably do have primary hyperparathyroidism, but it's also normocalcemic at the moment. She agreed to refer me to herself on the NHS. So yesterday, I'm so grateful for this, but the whole process has moved really quickly. I had to do a 24-hour calcium urine test where I had to collect every drop of urine for 24 hours. So I started at 8 a.m. one day and finished at 8 a.m. the next day. Then I had to take my almost 3 litres of urine to the hospital on the train and in a taxi. It was in a rucksack, so no one could tell, luckily. And you have to keep it upright as well, so that was quite nerve-wracking because I obviously didn't want it to spill. I handed it in at the hospital. I had some blood tests. I had a genetic blood test, which might take up to 3 months for the results to come back. I also had my parathyroid, vitamin D, calcium, I think my liver function and a few other things tested. And I've got a scan booked for Monday, which is called a sestamibi scan. They inject a radioactive tracer into your arm, which I'm not happy about, but because I try and live quite naturally, so the fact of something radioactive makes me feel really uncomfortable. But, you know, it needs to be done. And it goes and it'll show what's going on in the neck. So it'll show any growths or anything in the neck. Sometimes the scans don't show anything, even if there's something there. I also had an appointment yesterday with my new consultant, and she has booked me in for an ultrasound of my neck as well, which I'm waiting for an appointment for. She's phoning me in a month's time to give me all my results, and it will then be decided whether I need surgery for this. I just want to talk about this process. So this is part 1. I am going to do other videos to keep you updated. The reason I wanted to make this video is because there's probably a lot of people who have this and don't realise it. And I'm not trying to scare anyone, and I'm nothing like that, but because it's not routinely tested for, like when I think about it, my nan had osteoporosis. I'm wondering, did she have this? Especially if it's a genetic type, did she have this and it was never tested for? I think other people in my family have had osteoporosis, and it just makes me wonder. So I'm going to talk a little bit more about some of the symptoms that I experience or that other people experience. So bone pain is one that a lot of people experience. I don't have this too much, but I do actually, I suppose. I've had hip pain ever since for over 10 years. I've had hip pain since I was pregnant with my youngest daughter. I do get like a lot of pain in my knee. Fatigue is a very common symptom. I have noticed that I didn't used to need a nap. The only time I would need a nap is before my period was due, in those few days before my period. Now I need a nap every day, and that is not like me at all. Frequent urination. As I said, I had almost 3 litres of urine in 24 hours, which is higher than the average. Frequent thirst or increased thirst, that's another symptom. Kidney stones is another symptom. A lot of people get really dry skin, including myself. Oh, the reason I mentioned the aftershave at the beginning of this is because I've found in that group a lot of people have chemical sensitivities. So all these years I've been putting it down to being neurodivergent, and I do think that the sensory issues are a big part of it. But I also think it could be parathyroid also contributing, particularly with the chemical smells, because even though I've always been sensitive to smells and textures and sounds and things like that, I used to be able to wear perfume, and there were certain perfumes that made me feel really sick when I wore perfume, but now every single perfume makes me feel sick. Sometimes now even natural ones, but it's mainly to do with chemicals. So yeah, I found that from speaking to other people in the group on Facebook, a lot of people have chemical sensitivity. There are so many things. Obviously, it then goes on to cause osteoporosis, so people's bones breaking easily, heart palpitations. There's lots of symptoms that can be caused by it, and I just wanted to make you aware of this in case it's something that you could be experiencing. If you've ever had high calcium, ask for your parathyroid. So anyway, I'm going to keep you updated on this in case it's something that you could be experiencing yourself or you might be interested in. I am going to go for my scan on Monday. I am nervous about that. I'm going to be at the hospital for a few hours because they have to inject the dye, then you have to wait, then you get scanned, then you have to wait again, then get scanned again. So after that, at some point, I think soon I'll be having an ultrasound, and it is possible, let me just add, that some people have about 5 different types of scans and nothing shows up, because especially if it's one of the genetic types, sometimes it means all 4 parathyroid glands are affected, but it's just like almost like rogue cells on each one rather than one big adenoma. So it doesn't always show up on scans, and even people with adenomas, that doesn't always show on scans, and then when they have surgery there are still growths on their parathyroid. Oh, also, this is the bit I forgot. If you are advocating for yourself, I advocated for myself, and I've actually got the ball rolling quite quickly because I was so nervous about leaving it and waiting in case it turned into osteoporosis. I really, really recommend do your research all the time, which I know you do because you're neurodivergent, but do your research and there is always an answer. There's always a solution to things like this. I am getting treated on the NHS much quicker than if I'd have just waited for a referral. Thank you for watching. If you found this video interesting or valuable, or you want to hear what happens next, then please subscribe and also check out my other videos. I will keep you updated with a part 2, and if you're experiencing this too, you're not alone, and just have a look into it.